Now we will go to the palpation. The palpation, we are going to confirm the inspectory findings. How to palpate? The trachea, you have to see which side the trachea is deviated. That could be confirmed by using the three finger test. You use the ring finger, index finger and middle finger. Keep the index finger and ring finger at the junction of the sternoclavicular joint on either side, and you keep the middle finger over the trachea and try to move it horizontally from side to one side to other side, and choose the most prominent point on the trachea, which is coming most anterior part of the trachea, and see the distance between the middle finger and the other two fingers. The distance between the middle finger and the other finger, which side is less, is the side to which the trachea is deviated. Here if you see, you can clearly observe the middle finger is more nearer to the index finger. So that means it is deviated to the right side. This is one examination. And the other part is try to insinuate the finger between the sternocleidomastoid and trachea, and which side is more resistant, it is the side on which the trachea is deviated. And another thing is you observe the angle between made by the peak angle between the trachea and sternocleidomastoid, which side the angle is going upward is the side to which the trachea is deviated. That can be confirmed even more pronouncedly by asking the patient to press on your palm and look for the angulation on the both sides. See, you can clearly observe the right side, it is at a higher level. That means the trachea is deviated to the right side. And then along with the trachea, mediastinum also moves. So in this case, I expect the mediastinum, the apex also to move more medially. So you try to palpate more medially at the side, and here I could see the apex being felt more medially. It is more medial to the midclavicular line. That is one thing. And another thing is see the respiratory movements. From the posterior aspect, you keep your both palms on the shoulders and try to keep your fingers to touch at the midpoint, and see the respiratory movements occurring on both sides. If you see, you are able to see the elevation of the palm on the right side and the left side. If you see, the movement is better on the left side compared to right side. Okay. So that indicates that the respiratory movements are decreased on the right side. You can do the same by keeping your hands like this also, and see the respiratory movements on both sides while the patient is taking quiet breathing. And on the anterior side also you can do the same way, like keep the hands like this and try to observe the movements of the chest on both sides. See, likewise you will examine the respiratory movements. And also in the palpation part, you will have to inspect the ribs and the intercostal spaces. You may be able to see the intercostal spaces widening or narrowing in certain of the cases, and you may be able to see the tenderness at various places. And sometimes when you press over the ribs, you may be able to see the cryptus if there is any fracture of the rib. So all those things you have to examine. Here in this case, you see, here the swelling also, because it is there, I am trying to palpate the swelling also. See, this swelling seems to be very hard. The swelling is very hard, and not movable. It is fixed to the underlying structures. So this indicates that it is a malignant swelling. And you see sometimes it is fixed to the muscle also. If you make the movement of this swelling, it is a little bit making a little bit of movement anterior posteriorly, and see the upward and downward movement is not happening. So it indicates that it is also fixed to the muscle. So these are all the things you will observe in the palpation. During the process of palpation, we have examined the patient while he is taking the regular breathings. Now we will try to examine the patient when he is speaking, producing sound. When he is speaking, the sound will be produced in the larynx, and that is transmitted to the chest wall by producing vibrations. Now we will try to feel the vibrations on either side of the chest. For that we will use the right hand palm, whichever the dominant hand is, you try to use the palm and use the ulnar side because it is most sensitive in the palm. So this also we will follow the same rules as we were doing during the percussion. So try to put the palm on the normal, supposedly normal side first and abnormal side next in the corresponding areas. Likewise, it is better to ask the patient to make some word which is usually nasal in nature. It's like 99, 99, 99. Ask him to repeat each time he repeats. You try to see the vibrations that are transmitted onto the chest wall. Here in Telugu people, the uneducated people may not be able to tell 99. So you can ask them to say Nana, Nana, and in the moderate voice, not very loudly or very whispering like Nana, 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 Nana. Likewise in the posterior side also you will auscultate this way while he is uttering the word. Likewise we will see the difference. So that's about the vocal fremptus. There are certain conditions where you will see the vocal fremptus diminishing. In certain conditions we will see the vocal fremptus increasing. So the vocal fremptus decreases when the sound is not transmitted to the chest wall. That occurs when there is obstruction to the airways, major airways, or when there is something is lying between the chest wall and the lungs, like air or fluid in the pleural cavity, or gross thickening of the pleura and underlying fibrosis and all, you may find it to be diminished. Whereas in certain conditions where there is a consolidation and big cavity which is connected to the major bronchi, you may see the vocal fremptus increasing. So this is as simple as that. This makes the vital capacity, this fremptus, vocal fremptus done. And you see the vocal fremptus a little diminished in the areas where the heart is there along with the lungs. In that area, slight diminution of the vocal fremptus you may find. This is about the vocal fremptus. For doing anthropometry, we will use two flanks which can overlap from one side to the other side of the chest, both anteriorly and posteriorly. The long flank you should be able to take. If it is not available, you can use the long book with stiff covers. So here we are using the stiff covers, long books. See here, if the patient is asked to hold it without moving, also is okay. But you see from above, there is anteriorly it is more nearer and posteriorly they are more away. So in such a case, what you should do is try to measure the distance between the anterior parts too. two anterior parts at the same level. See here it is 5.5 and half approximately, and here it is 13 and half. 5 and half and 13 and half is making 19. You make half of it. It is around 9.5. So likewise you can do that. Now you can take the help of somebody and keep it parallelly. Try to keep it parallelly and then try to measure the distance. This is 10. So it is almost coming as 10. So this is also is one way of always measure the two sides anteriorly and posteriorly and make it half, that is the better. And then anteriorly when you are doing it, you keep the books like this and try to measure the both sides. See it is 7 plus this side, and I am not able to do it. Actually it needs a larger, this is also 7 and half. So 7 and half into 10 literally. So it's normally the ratio of anterior posterior to lateral is 3:5, 3:5 or 5:7, so something like that. So it's almost okay. Comparatively, there is a little bit of anteroposterior diameter increase is there, but it is not a florid barrel shaped chest. This is one important thing. And another thing is you see the respiratory movements also, how much respiratory excursions are occurring also you can confirm with the tape. The one thing is you try to keep the tape horizontally, you should encircle the chest at the level of the fourth or fifth intercostal space. Always see that it is horizontal. You see the other side also. See, it should not go down or up. You observe it clearly and then you observe the movements that he is making. The centimeters part is better because he is making very little movements. So at the he is almost making almost 1 centimeter only he is making. See, you see the hemithorax enlargement. Now you can confirm the respiratory movements by using the tape also, and you keep your stent surrounding the chest at the level of the fourth intercostal space. Never take nipple as the marker because nipple is associated with skin, so it may dislodge downwards in some of the patient. So take at the level of the fourth or fifth intercostal space and see that it is at the same level on the posterior aspect also, and try to look for the respiratory movements. So here it is the entire chest expansion, that is to be noted. And then this is the hemithorax. You keep the other side on the spine midpoint and use the chest at the midpoint of the sternum, and then try to see the respiratory movements on either side. See, this also proves that the respiratory movements is diminished on the right side. So these are the important findings in the examination of the chest.